Okay, hello. This is my complete head to toe practice. I'm gonna try my best to do it. I still don't have it down, but this is what practice is for. Okay, watch. Okay. Okay, so
Come in.
you can hygiene. Okay, my name is Armando Farias. I'm gonna be your nursing student today. Can I get your name and date of birth?
Angel Cepeda, 11/16/99.
And can I check that? Make sure the bed is locked. Provide for privacy. How old are you?
20.
What's your occupation?
Full-time student
And where were you born at?
in Hobbs, New Mexico.
Okay, so what brings you into the clinic today?
I have a pain in my knee.
Okay, would you tell me when this pain started and what were you doing and what were the symptoms you were experiencing?
It started 2 days ago, and I was running, and I just all of a sudden got a sharp pain in my knee.
Okay, now what makes this pain better or worse?
Running on it makes it worse, and icing and taking ibuprofen makes it better.
Okay, would you describe your pain? Is it sharp, dull?
Sharp.
Where's the pain located exactly at?
Right here?
Okay, has it spread somewhere else?
No.
What are some relief measures you use?
I take ibuprofen and I ice it.
Okay, now, would you scale it from a scale of 0 to 10, 0 being no pain, 10 being the worst pain you ever felt?
It's a 5.
Okay, now, is the pain constant, intermittent, or both?
It's intermittent.
Okay, what are you not able to do because of this pain?
I'm not able to run.
Okay, now, another pain I should be aware of?
No.
Okay, now, we're gonna take your temperature. I don't have a thermometer, but I'll use this. Normal temperature should be 96.8 to 100.4. So I go up and down. Beep. And your temperature is 97, which is normal. Now I'm gonna take my hair radial pulse. And see, it should be between 60 to 100. Okay, your pulse is 80. It's within the normal range. Now I'm gonna check your respirations. Okay, so your respirations are 12. Is within the normal limits because respiration should be 12 to 20. Your pattern was stable. It was normal. You didn't have no tachypnea or bradypnea. I didn't see no other accessory muscles being used. And now I'm gonna go ahead and take your blood pressure. So I wouldn't do blood pressure on one that has a fistula, a shunt, a PICC line, or an IV. Okay, would you put your sleep up? Okay, now I'm gonna go ahead and do the two-step method. Could you hold it for me? Okay, I stopped feeling it at 96. So I'll wait a minute. Also, you wouldn't do blood pressure on arm that had a breast or axillary surgery. I forgot if I said that. Blood pressure should be below 120/80. Now I'm gonna find her pulse. It's right here. Okay, I've stopped feeling at 98, so I'm gonna go all the way up to 128. Okay, your blood pressure is 102/60. And then I'm gonna go ahead and take your oxygenation, which would be with the pulse ox. So if she had any nail polish or anything like that, I would clean it. And I would clear the site that I'm using in the pulse ox as well. Beep. It's 96. The oxygenation, it should be 95 to 100. Now I'm gonna ask you some questions, ma'am. Have you had the measles, mumps, or chickenpox?
No.
And if you did, I would ask what age. Have you ever been diagnosed with hypertension, heart disease, or diabetes?
No.
Are you allergic to any food, medication, or any environmental condition?
No.
And can I recheck that? Okay. Now, has anyone in your family ever been diagnosed with cancer, high blood pressure, or a heart disease?
No.
Okay. Are your parents still alive?
Yes.
How old are they and how would you describe their health?
My mom is 43 and she's in good health, and my dad is 46 and he's also in good health.
Also, okay, so what's the last grade you completed?
12.
Do you think your income is adequate for your lifestyle?
Yes.
Do you have any religious practices I should be aware of?
No.
What are some of your self-care behaviors?
I like to go running in the afternoon, and before bed I like to read a book.
Okay, tell me about your daily days.
I wake up at around 8 and I go to my online classes, and then in the afternoon I go for a run, and then after dinner I like to read a book and go to bed.
Okay. So do you drink alcohol, smoke tobacco, or use any drugs?
I drink alcohol.
Okay, and out of the week, how many days do you drink?
3 days.
And on average, how many drinks do you have in that
I
drinking
have
days?
like a full bottle of wine.
Oh, Okay, I'll perform my case assessment. Have you ever, have you ever felt the necessity on cutting down on your drinking?
No.
Has anyone been annoyed by your drinking, or have you been annoyed by your drinking?
No.
Do you feel guilt after a night of drinking?
No.
Do you need an eye opener to get the day going?
No.
Oh, okay, ma'am. So now we're gonna ask some really personal questions. So if you feel like not answering them, or you don't feel comfortable, please let me know and we'll stop. Okay?
Okay.
In the past 2 weeks, have you felt depressed, hopeless, or down?
Yes.
In the past 2 weeks, have you felt little or no pleasure or no interest in pleasurable activities?
Yes.
Okay, now I'll perform the PHQ-9. I'll also make sure that this patient is safe. Make sure to someone to watch her. Place her on suicide watch if the PHQ-9 is indicates it. So, have you ever felt, or do you feel like life is not worth living?
No.
Do you have a plan to harm yourself?
No.
Okay, now I'm gonna do her mental status. So her posture is erect. Her body movement it's normal. It's not like erratic. Her dressing is appropriate to the season. Her hygiene is good. This patient is alert. Also, her speech is normal and clear. It's not rapid or slurred. And okay, ma'am, I'm gonna ask you some questions to know your orientation. So, what's your name?
Angel.
What time is it?
7.
And where we at?
Brittany's.
Okay, so I know that this person's attention span is good. Because she's not deviating whenever I'm asking questions. Also, I know her recent and remote memory is good because she's able to call from events from long time ago and recent events. This patient makes sense, and this patient is not suicidal. Also, now I'm gonna go ahead and take your weight and your height, and also I'll do your waist circumference. So take off your shoes. Would you step on the scale looking that way? Okay. So it's 65 inches, 5'5". So would you step off the scale now? Would you go looking face? 140. Okay. Now I'm gonna take her waist circumference, and that'll be on the smallest point of the waist. So it's 29. And now I'm gonna do her BMI and this grass piece of paper. I got my calculator over here. So 65 inches, 140 pounds. You divide that 2 kilos divided by 2.2. So it's 63.6 kg. Now her BMI is 140 divided by 65 squared times 703. So her BMI would be 23.3. Okay, ma'am, now we're gonna go ahead and do your eye test, the Snellen chart. So I'm gonna have you stand up. So it'll be 20 feet from the Snellen chart. So would you stand right here? Wait. Okay, now tell me the smallest letter that I'll cover one eye and tell me the smallest letter that you can read. Can you read this?
D E F P Q T E C.
Okay. Can you read the line below it? This one.
No.
Okay. Would you cover your other eye? Now, would you read the smallest line that you can read?
FELODZB. Oh, PZB. I'm sorry.
Can you read the line below that one?
No.
Okay, so your vision is 20/40 on your right eye and 20/32. So I will refer you to a physician. And also I would know if you were squinting, leaning forward, or if you missed any letters. And yeah. Now that you're standing up here, I'm gonna perform your range of motion exercises. So I'm gonna have you abduct your leg, which is just like raise it up like this. Okay, your other leg as well. Now I'm gonna have you adduct it, which is you just bring it in like this. The other leg as well. Okay. Now I'm gonna cook my hands, and okay, so you're gonna have to go like this. Go like this forward. And now this is to know any pain or crepitus, which is just cracking. Now put them back like that. Okay, now put them up your scapula as high as you can. Okay, put them to the side. Now go like this. Wait. Now put them on the back of your head. Okay. Now I think that's it for that one. Yeah, that's it for that one. So now we're gonna go ahead do the elimination pattern. You can sit down. Oh no! Stand up. Now I'm gonna have you go like this. Now to the other side. Now twist to the other side. Okay. Now we get it down. Okay, now I'm gonna do your elimination, I think. Okay, I'm gonna do your elimination. So I'm gonna inspect your stool, and I'll look at the color, the consistency, if it was like solid, soft, runny. I would look at the the blood and the amount. And also I would ask you for your last bowel movement. I would ask you the date, the time, and the characteristics of it. Okay, now I'm gonna perform the functional mobility assessment. Are you able to bathe yourself without any help?
Yes.
Are you able to dress yourself without any help?
Yes.
Are you able to go to the toilet and get out the toilet by yourself without any help?
Yes.
Can you practice full retention of the urine?
Yes.
Okay, are you able to feed yourself without any help?
Yes.
Okay, so now I'm gonna have you lay down.
You might have to move it. I don't know. It might be good.
Right there. I'm sorry for the technical difficulty with my thing. Okay, so I'm gonna palpate your abdomen, and I'm going to run a light through it. I would like put your this for your shirt up, but we don't want that right now. And I'm gonna check for any striae. I'm gonna check for the symmetry, if it's bilaterally. I'm also gonna check the color and the size, if it's scaphoid or flat. I already said color. I'm also gonna check for the venous patterns. So some major organs. In the right upper quadrant, you have your liver. In the left upper quadrant, you have your stomach. On your right lower quadrant, you have your appendix. On your left lower quadrant, you have your sigmoid colon. On the midline, you have the bladder. And then I'm gonna observe for any like palpitations on the major arteries, which is aorta, renal, iliac, and femoral right here. And also I'm gonna osculate them for any bruit with the bell. Okay, I didn't hear no bruit. I will do it bilaterally, of course. Now I'm gonna osculate the other quadrants to check for any vowel sounds. Now I'll do that with the diaphragm. So you start at the right lower. And that's to see if it's normal active, hypoactive, hyperactive. Okay, so all the quadrants are normal active. So now I'm gonna percuss, and this is to check for any tympany or air. I'm tympany, which is air, and then dullness, that can indicate adipose tissue. Adipose fluid, a mass, or a distinct bladder. So I'm gonna percuss. Okay, now I'm gonna do the fluid shifting test. Which that one is that you percuss from the side to the umbilicus. That's to check for any dullness. Also on the other side, now you have the patient like turn, and you palpate from the side to the umbilicus, and that's to see, to hear any dullness, and that indicates fluid, and you have to mark them out wherever you hear fluid. So you put your hand on the other side, and you hit it, okay, and you feel if the fluid shifts like this. Okay, now I'm gonna palpate the abdomen for muscle rigidity, for muscle guarding, any masses or any pain, okay? Tell me if you feel any pain. Okay, now I'm gonna do the Eliopsis test, and that's to check for appendicitis. And now I'm gonna have you to raise your right leg up. Okay. And you feel for any of this. Does it hurt?
No.
Okay. Okay, now I'm gonna do the range of motion while she's laying down. So, and that's again to check for any pain or crepitus. Right now I'm doing the hip. Okay. Now it's your knee. Oh, active range of motion is the patient doing them, and passive is me doing it for them.
Now we're gonna go record an edge because the lady from Canvas and my Wi-Fi sucks and the probability of it now uploading. For now, we're going video is very low.
Okay, so now I'm gonna have you do foot pedals. Push. Okay, thank you. Now would you sit for me? I will also inspect for the. I will also check the feet and the toes. Now I'm gonna palpate the shoulders for any pain or crepitus. Now do your shoulder shrug. Now do your shoulder shrug. Okay. You could do it with resistance. I will, for all of them, I will also check for muscle strength, if they have atrophy or hypertrophy, and the asymmetry. I will, now we're going to go ahead and do the elbow, so flex them, extend them. Okay, now do supination, which is like this to this, and then pronation, which is like that to that. Yeah, you got it. Now, extend your shoulders. I mean, your shoulders, your elbow. Flex them. Okay, thank you. Now, I'm gonna go here and do the wrist and the hand. So, go to your wrist like this. Go like this. Now, extend your fingers. Put them down. Okay, now touch your fingers to each one. Now I'm gonna do the carpal tunnel test, and you just hold it like that for 1 minute, and if it starts hurting, that means that's an indication of carpal tunnel. Okay, now I'm gonna have you point down your toes like this to the ground.
I can't do it with you.
Okay, now flex your foot like this. Okay, now do eversion and eversion, so turn your sole in and then out. Okay, nice. Now on the knee, I'm gonna place my hand on the kneecap, check for any crepitus, feel the quadriceps, then bilaterally, move it like that. So now I'm gonna put my gloves back on. These gloves are too small.
Armando.
Well, I'm recording,
I
Brittany.
know, after y'all finish recording, go to Ebbs.
Okay.
Alright, my mom said.
Okay.
So record yours at Ebbs, Angel. Did you hear Armando?
Okay, now I'm gonna inspect the head to see for any protrusions or any depressions. The head is normal cephalic, meaning that it's round. Also, the hair is evenly distributed and soft to the touch. I'm gonna, her eyebrows are symmetrical to her eyes. Would you close your eyes? She has complete closure of her eyelids. Her eyelashes are evenly distributed, and there's no redness or swelling of the eyes, of the eyes, of the eyelids and the eyelashes. The eyeballs are in their socket. They're not anophthalmos, meaning sunken, or exophthalmos, meaning protruding. Also, okay, which is mouth for me? Okay, her nasolabial folds are even, and there's no drooping in the mouth. Now I'm gonna search for Perla, which her pupils are equally round, and they're reactive to light and accommodation. So I'm gonna have you look at items like over there. So this is to dilate the pupil, and then you just go like this. Okay, so it constricts. Now I'm gonna have you look at the pen light. Okay, it constricts. And yes. Now I'm gonna look at the oral cavity. Her lips are pink and moist. Which is mouth for me? her teeth and the gums, there's no discoloration or bleeding, and I can see a presence of saliva. Now I'm gonna do the range of motions in the jaw. So I'm gonna have you partially open your jaw, and then open it completely, and then push your jaw out. Now move it side to side. Now I'm gonna feel it at the temporal mandibular joint. Partially open your mouth. Feel it like this. Move it side to side. Okay. And now open your jaw. Okay. Now I'm gonna have you look to that side. Okay, now look to this side. Okay. And then, okay, so now I'm gonna perform her, check your sensation. So, like, so now I'm gonna have the client close her eyes, and I'm gonna touch her with a like cotton swab, but I don't have any, so I'm gonna use this. And so I'm gonna touch and you tell me whenever you feel it. Okay, say now.
Now. Now. Now. Now.
Okay. Now I'll get alcohol swab, and I wouldn't tell the patient. I'll get an alcohol swab, and I will test her smell. I'll have her occlude one of her nostrils. So close one of your nostrils and tell me. Okay, I'm so sorry. I just got a call and it got interrupted, but we were on the. So now, where do you smell?
Alcohol swab.
Okay. Now I'm gonna go ahead and do the puff your cheeks for me. Puff them out. Okay. Now, now I'm gonna assess your neck. So it's erect towards the midline, and now we touch your chin to the chest. Now, would you look up? Now, would you touch your ear to your shoulder? The other one. Okay. Now do touch your chin to the chest. Look up. Now, ear to the shoulder. Ear to the shoulder. This is to check the range of motion and also to check for the spine. So, now I'm gonna go ahead and do the Glasgow Coma scale, which her eyes are opening to response. So that'll be a 4. Her verbal is she's oriented to person, place, and time. So that'll give her a 5. And she's been obeying the stuff that I've been telling her, so I'll give her a 6. So that gives her a Glasgow Coma scale of 15. And now I'm gonna do the FAST acronym, which is face drooping, which she don't have any, arm weakness, where she don't have any, slurred speech, where she don't have any, and time to call 911 if I see any of these signs. So now I'm gonna look at her jugular vein distension. So I don't see any. Now I'm gonna palpate the carotid. Okay, now I'm gonna do it on this side. Now I'm also gonna osculate the carotid artery for any bruits with the bell. Would you take a deep breath whenever I put it, and then it'll be at the angle of the jawline. Okay, now at the mid. Okay, now at the base. Okay. So I didn't hear no brooding. Now I'm gonna palpate all her pulses, which would be radial, ulnar, brachial, temporal, and then carotid, and then apical, which you go angulus lui, and then to the 5th intercostal space midline. So it would be, which you lift it up for me. So it would be like right here. Femoral, which I'm not gonna touch it. Popliteal, which is on the back of the knee. Dorsalis pedis, which is like right here. And posterior tibialis, which is here. And I would grade. Oh well, I have to pop it. So radial is a 2. No, it's a 3. I'm sorry. It's a 3. This one's a 2. And the apical, which is lifted. Okay, it's a 2. From where I cannot tell. Popliteal, let me see if I can feel it. I'll say it's a 1. Dorsalis pedis, a 1. Posterior tibialis is a 2. Now I'm gonna assess for any edema on her legs. And if she did have edema, I'll grade it from a scale of 1 to 4, which is 1 is mild peeling, 2 is moderate peeling, 3 is deep peeling, and 4 is very deep peeling. Also, I will check her nail beds. They're round and smooth. They're not jagged. Now I'm gonna do her capillary refill, which is 1 second, and it should be below 2 seconds. Her skin is warm to touch. Her pigmentation is evenly according to her ethnic background. Her skin is also not diaphoretic. I will ask for any wounds, and I'll document the location and color and exit date, and then I will ask for any lesions, and I will note the asymmetry, the border, the circumference, the diameter, and the elevation. Now also I'm gonna look for any hair growth and any tenderness on her skin, which is just normal. Now I'm gonna listen to the chest. So take a deep breath. Take a deep breath. Now would you move it like this? Okay. Take a deep breath. Okay, take a deep breath. Now take a deep breath. Now take a deep breath. Now take a deep breath. Take a deep breath. Okay, now I'm gonna listen on the back. Would you turn around for me, please? So take a deep breath. 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 And take a deep breath. Okay. Now I'm gonna have you say for the tactile for motors. So say 99.
99.
Say 99.
99. 99. 99. 99.
Bless you. Bless you. Now I'm gonna osculate your the heart. So I'm gonna start with would you try to move it for me? That's on the second clavicle. So it's the aortic, pulmonic, herbs, tricuspid, and mitral. And so now I'm gonna palpate your chest. So this is to know any symmetry. So it's like you put it like this on her chest. Breathing. Okay, so it's normal. The chest should be from a ratio of 1 to 2. And I'm gonna percuss the costral. Oh, what's it called? Well, I'm gonna percuss the kidneys. So you put it on the 12 breathe and go like this lightly and go like this lightly. Okay, and I think that'll be it. Thank you.
Thank you.